Now, for more on the Nigeria Governors Forum post-COVID-19 blueprint, we have Dr. Henry Ewunonu, Chairman, Nigeria Medical Association NMA Advocacy Committee. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you. Good afternoon, viewers. Henry Ewunonu, to correct, Henry Ewunonu is not the Chairman Advocacy again, because that tenure has ended. I am now a public health advocate and a public health rights activist.
Lovely, noted. Thank you so much for joining us.
As such.
All right. Let's first get your thoughts on the national response to the coronavirus so far, just before we come into the post-COVID-19 blueprint. What do you think the response has been with the federal government and also at the state level?
Well, the response could be likened to many very practical issues in the polity. For instance, performance of our teams, either at the World Cup or at the Olympic Games or any other international competition. Because we are playing the same game, expected to score goals to advance. So, likening it here, we are expected to respond in a way to prevent or reduce transmission of the disease, to prevent more people from dying, to increase recovery rate. If you watch, most of those games, we don't advance, like Olympic Games, we don't, middle table, we're always low. World Cup, we hardly advance to the, I don't think we've ever reached the quarterfinal stage. So here too, you see, you don't put something on nothing and it will stay. How will Nigeria have responded better when the foundations are weak? It's the Holy Book that says where the foundation is weak, what can the righteous do? Even if you bring the best of hands, the members of the PTA, for instance, have shown, the chairman has shown excellence. But what can he do when the infrastructure is not there? When the funding is inadequate? When every other thing, logistic management, every other, including the most critical, which is participation of the citizens. Citizen support lacking. So we are doing as we can do. We don't, I didn't expect we would do better.
So, Dr. Ewunonu, you're saying...
We are trying our best.
You're saying the fragile healthcare system is... Yes, you're saying the fragile healthcare system in Nigeria, one of the foundations, of course, is a problem. But, I mean, we were faced with a pandemic. No one expected, we didn't anticipate this. Moving forward and looking at what government is doing, the NGF and the blueprint, accessing more funds, stakeholder collaboration, what would you advise them to do?
I will refer us to a release that came from, I think, the United Nations or the WHO a few days back that said health is a choice for nations. Good health is a choice. Just like you make any other choice in life. This is the right. This is the pathway of good health. This is the pathway of diseases. If you follow this path, you are healthy. If you follow the other path, you are, you suffer diseases and die. So choose health. That's what the world is advising nations of the earth. So following from there, my advice or my take on this is that the nation should choose to live. Choose the path of good health. We have been provided with knowledge. Knowledge abounds. Health is supported on 6 structures or pillars. Service delivery is just one aspect. Most of the time we think that service delivery is all about health. Service delivery is just one of the pillars. For me, the most important is accountability, leadership and governance, the political will. For instance, the various rankings in the health sector. Nigeria is always at the bottom of everything. Just in June, we just got delisted from polio-endemic, the register of polio-endemic nations. So if the president of Nigeria at the very top, the governors, the legislators, everybody, including you and I, decide that moving forward, we will be healthy. We will be delisted from those countries where even diarrhea, cholera is still killing people. We'll move forward. So COVID-19 has just come again as a catalyst to help us take us to the right path. Are we learning the lessons? Are we observing what is happening? Have we made that commitment? The resolve to be better? So if we now resolve to fund health better, and the citizen will be there for accountability. The citizens should be there to say, no, this is not what we elected you to do.
Thank you so much, public health advocate. We appreciate your time. Wish we had more time to continue this issue, but we'd like to thank you so much. Dr. Henry Ewunonu, thank you for joining us on the program.